Today I'm going to be talking about the harms associated with the injection of image and performance enhancing drugs. Firstly, I'd like to thank the organisers of today's conference for inviting me to speak. The focus of this presentation is on injection and harms, and the most commonly injected image and performance enhancing drugs are the anabolic androgenic steroids, and these will be the focus of the data that I'm going to be presenting today. There is evidence to suggest that the use, and in particular the injection of image and performance-enhancing drugs, has increased in many countries over recent decades. Most of this evidence comes from increased presentations by those using anabolic androgenic steroids and allied drugs at needle and syringe exchange programs. However, the evidence we have on the extent and any potential changes over time on the size of the population using image and performance-enhancing drugs is limited. However, there are a number of public health concerns related to the use and the injection of image and performance-enhancing drugs. For example, there's evidence to suggest that the use of anabolic androgenic steroids can cause harm to the heart, liver, and brain. When it comes to the injection of image and performance-enhancing drugs, there is, of course, the risk of infection. And these will include the infections commonly associated with injecting drug use. That is skin and soft tissue infections, primarily caused by bacteria, and blood-borne viral infections such as HIV, hepatitis B and C. Blood-borne viral infections can be acquired through injection practice, particularly the sharing and reuse of injecting equipment, and also sexual behaviours, with the latter being a particular risk for HIV. Skin and soft tissue infections result from poor hygiene around injection, particularly the contamination of injection equipment from bacteria in the environment and on the skin. The injection and sexual behaviours that increase the risk of transmission of infections and the prevalence of infections such as HIV, hepatitis C, hepatitis B and skin and soft tissue infections have been extensively studied amongst people who use and inject psychoactive drugs such as heroin and amphetamines. However, much less is known about the extent of these bacterial and viral infections and the associated risk and protective behaviours among those who inject image and performance-enhancing drugs such as anabolic androgenic steroids. And this in part reflects that historically those who inject image and performance-enhancing drugs were seen or at least perceived to be at lower risk of infection. And this is related to the fact that there are differences in the injection practices between those injecting image and performance-enhancing drugs and those who are injecting drugs primarily for the psychoactive effects. Image and performance-enhancing drugs are injected intramuscularly and subcutaneously. Psychoactive drugs are usually injected intravenously. This different approach to injection will affect the amount of blood that can be in the environment, and so it was generally perceived that there was probably lower risk of blood-borne viral infections through intramuscular and subcutaneous injection than there was through intravenous. Similarly, there are also differences in the way these drugs are prepared. Psychoactive drugs usually come in powder form that require complex preparation, and this preparation may occur in environments where hygiene is very difficult to maintain. Image performance-enhancing drugs often come prepared for injection, for example as a liquid in a vial, or are easy to prepare and is typically perceived as being used in environments where hygiene is much easier to maintain. And these differences probably underpin, partly at least, why there's been less investigation on the extent of infections amongst those who use and inject image and performance-enhancing drugs, such as anabolic androgenic steroids. In this presentation, I'm going to give an overview of what we know about the extent of injecting risks, sexual risks, skin and soft tissue infections, and blood-borne viral infections among people who inject image and performance-enhancing drugs. This data is drawn from samples of individuals who are predominantly injecting anabolic androgenic steroids and allied drugs. I will then go on to consider recent data that's currently in press that's looked at the uptake of testing for blood-borne viruses among people who inject image and performance-enhancing drugs, before going on to consider what these data mean in relation to responses to infections among those who use and inject image and performance-enhancing drugs. Using data from a recently published review, we're first going to explore the extent of injection and sexual risks amongst those who inject image and performance-enhancing drugs. Firstly, we'll look at the extent of those reporting injection risks, focusing on those who ever report a number of risks. Firstly, those ever reporting the reuse of their own needles and syringes. And 4 studies have looked at this have found rates of between 8 and 15%. Secondly, the sharing of needles and syringes. The 9 studies have looked at this and have reported rates of between 0 and 22%. And thirdly, the sharing of multi-dose vials with another person. 6 studies have looked at this and between 2 and 43% reporting sharing a multi-dose vial. As can be seen, the numbers reporting sharing various items of injecting equipment vary greatly between studies. This will reflect the fact that studies have recruited different population groups at different times and have used different methodologies and measurement methods. However, these data do suggest that there is a significant level of equipment sharing amongst those who inject image and performance-enhancing drugs. However, this may be partly related to the fact there is an overlap between this population and the population that injects psychoactive drugs, with 4 studies suggesting that this is between 5 and 27%. Though some caution is needed with interpreting this, as some of the psychoactive drug injection could be related to injecting those drugs, for example amphetamines, for enhancement purposes, for example in relation to weight control. However, together these data do suggest that there is likely to be some injection-related risks for blood-borne virus infections and bacterial infections among those who inject image and performance-enhancing drugs. As these data are all based on self-reports and so therefore subject to a variety of biases which would probably most likely lead to underreporting, the levels of risk may be higher than suggested by these data. If we look at the studies that have examined sexual risks amongst people who inject image and performance-enhancing drugs, we find indications that at least among part of this population there are substantial risks for the transmission of such infections. If we look at the studies that have examined sexual risks during the preceding 12 months, we find that in these studies around half of the participants report having multiple sexual partners, and that levels of condom use are generally poor, with the vast majority reporting either no condom use or inconsistent condom use. Together, these findings suggest that at least among part of the population injecting image and performance-enhancing drugs, the risk of sexual transmission of infections, including the blood-borne viruses HIV and hepatitis B, is potentially substantial. Having looked at the extent of injecting and sexual risk behaviours amongst people injecting image and performance-enhancing drugs, now let's go on to look at the extent of infections, and starting with skin and soft tissue infections. A small number of studies have looked at the extent of symptoms of these infections, and these have usually relied on self-reports. Now, some of these symptoms, such as having an abscess or open sore at an injection site, will in fact a bacterial infection. Others, such as having redness, swelling or tenderness in injection site, may affect an injury as well as an infection. So I'm going to present the results from 2 studies, the first from the UK, and this found that around 2/5 had ever had redness, swelling or tenderness in an injection site, and 7% had ever had an abscess or open wound at an injection site. And another recent study from Australia found very similar findings, with similar proportions reporting both of these symptoms. Together, the results from these 2 studies suggest that the experience of injection site infections and injuries amongst those injecting image and performance-enhancing drugs, while not an everyday occurrence, is common. However, the levels of these remain much lower than they are among those who inject psychoactive drugs. A larger number of studies have looked at the extent of blood-borne viral infections among people who inject image and performance-enhancing drugs. Some of these studies have used self-reports, but here we'll focus on those studies that have used serological or biological markers of infection. These studies show that the prevalence of HIV is usually between 1 and 2%. They found prevalences of hepatitis B infection, that's ever infection with hepatitis B, between 4 and 12%, and prevalence of ever infection with hepatitis C between 4 and 10%. These findings suggest that these infections are an issue amongst people who inject image and performance-enhancing drugs. Whilst the prevalence of these is lower than you find in many samples of people who inject psychoactive drugs, the prevalences of these is also higher than amongst the general population in the countries that have been studied. HIV and hepatitis C are both infections that can be long-lasting. HIV is a lifelong infection, and for the majority of people who are exposed to hepatitis C also will go on to develop a lifelong infection. HIV is treatable, and there are drugs which can cure hepatitis C infection. However, to access these and other forms of care, it is necessary for these infections to be first diagnosed. So key to this is uptake of testing for these blood-borne viruses. Studies indicate that around 2 in 5 people who inject image performance-enhancing drugs have been tested for HIV and also for hepatitis C. These levels of testing are almost certainly insufficient to recognise most of the infections among this population group. If you look at hepatitis C, what we find is that among people who inject imaging performance-enhancing drugs, the majority remain undiagnosed for hepatitis C, with those who have injected a psychoactive drug much more likely to have their infection diagnosed than those who have not. I'm now going on to explore the factors associated with the uptake of HIV and then hepatitis C testing. Until recently, no studies had looked at this in detail amongst people who inject image and performance-enhancing drugs. The data I'm going to present over the next few slides is taken from a paper which is currently in press. In this study, a sample of people were recruited from community settings and asked to take part in a study. Those who agreed answered a questionnaire, and from that questionnaire, they were asked about their uptake of testing for hepatitis C and HIV. And using this data, we explored the factors associated with testing. I'm going to present the results from a multivariable analysis, an analysis in which a number of variables are taken into consideration to allow for the fact that there may be interactions between these. So you're going to see a couple of tables like this, which present the factors which are found to be associated with testing uptake in the multivariable model. The results are presented as odds ratios. An odds ratio basically is a ratio of two numbers. Basically, for the baseline category, it'll be 1, and in the category that's been compared to that, it'll be higher. So an odds ratio of 2 in a category will mean that the likelihood of the event occurring in that group is twice that in the comparator group. So what we find when looking at factors associated with HIV testing is that there are a number of factors which are to be expected. HIV testing is associated with sexual orientation, imprisonment, but also interesting, it is associated with recruitment setting. So individuals in this survey that were recruited through a service, primarily a needle syringe exchange program, had a much higher uptake of HIV testing than those who were recruited in the community, i.e. in a gym or other fitness setting. Similarly, another interesting finding was that those who reported having had a metabolic or physiological test were much more likely to also report having uptake of HIV testing. A couple of other factors are also associated with HIV testing, and these probably relate to differences in risk. Looking at hepatitis C, we find a similar pattern. Again, bisexual men are more likely to report uptake of hepatitis C testing. Those who had been imprisoned were more likely to report uptake of hepatitis C testing. But similarly to HIV, those recruited in services to needle syringe exchange programs were much more likely to have been tested than those who were recruited in community settings. And yet again, those who had had a metabolic or physiological test were also more likely to report uptake of hepatitis C testing. This study also asked about the motivations for IPED use. And it found the most commonly reported reason for IPED injection was to improve body image. Other commonly reported reasons were non-competitive bodybuilding, sporting athletic performance, competitive bodybuilding, and occupational performance. The motivations for IPED use were found to vary by recruitment setting. For example, those recruited through community settings were significantly more likely to report athletic or sporting performance as being an important reason for their use of IPEDs compared to those recruited through services such as needle and syringe exchange programs. The motivations for IPED use were also related to the uptake of blood-borne virus testing. Those who reported athletic or sporting performance was an important motivation for their IPED use were significantly less likely to report being tested for HIV. Whilst those who reported retaining or regaining youthful appearance, increasing sex drive, or use of IPEDs for hormone replacement therapy as important motivations for their use of IPEDs were significantly more likely to report being HIV tested. This study also looked at risk behaviours and found that these also varied by recruitment setting. Compared to those recruited through services, those community recruited were more often likely to report having shared a drugs vial and poor levels of condom use if they had 2 or more sexual partners, indicating that those in the community had higher levels of risk than those who were recruited through services. Those recruited in the community were also less likely to have been tested for blood-borne viruses than those recruited through services. These findings have particular implications in relation to consideration of the findings from previous studies. Many previous studies that looked at people who inject image performance-enhancing drugs have focused their recruitment on needle and syringe exchange programs. Therefore, caution needs to be taken with current estimates of the extent of harms and risk behaviours. as these may potentially lead to an overestimation in the uptake of bloodborne virus testing and the proportion of those aware of their status. It may also impact on our understanding of the extent of risks and the levels and extent of infections. Thus, targeted testing interventions are needed for those who inject IPEDs that are appropriate to setting and context. Approaches to increase the uptake of testing for bloodborne viruses among people who inject image and performance-enhancing drugs will need to focus on and reach people who are least likely to be tested. They will therefore need to access those who are not using needle syringe exchange programs and those without a history of psychoactive drug injection or imprisonment. The findings from the recent study of an association between the uptake of bloodborne virus testing and receipt of metabolic and physiological tests suggests a way forward. Those who use IPEDs often desire to access metabolic and physiological testing to monitor the effects of the drugs they're taking on their body and as part of their training regimes. Therefore, approaches that use the offer of a range of screening tests, including tests for infections and also metabolic and physiological tests, should be explored. Such approach may lead to an increase in uptake of testing for infections, but also lead to early identification of other problems and harms associated with the use of IPEDs.